All right. Hello, everybody. Welcome back. I'm Meredith with Intercept Treatment Foster Care. We are here again for our next part of our video interview series with Dr. John DeGarmo. He is the director of the Foster Care Institute and the founder of Never Too Late, a residential group home for boys. He is the author of several books on foster care, and we are so excited to have you back with us. Thanks for joining us.
Thank you so much. Thank you very much.
Yeah. So today we want to talk about some of the preparation that comes into play when preparing for a placement. And we can talk about, physically preparing your home, emotionally, and just things to consider. So I wanted to hear a little bit from you. Remind us again how many folks, how many foster children you've had in your home and over the years.
Well, with the 16 years, we've had over 60 kids, and as young as 27 hours of age and 18 years old. And placement's a very, it's very important. It's very important that you prepare for that. And what many people don't appreciate is this: no child wants to be in foster care. It's not a happy place for them. It took me a while to get that. I thought initially that, they're gonna be happy to come to my home. It's far from the truth. I want people to appreciate, or to think about this. Imagine, if you will, a 7-year-old girl who, at late at night, without any recognition whatsoever or preparation, she's removed from her home by a caseworker, maybe even the police, removed from her mom, her dad, sometimes her siblings, her stuffed animals, her toys, her pets, her dolls, her house, her home, her grandparents, aunts, uncles, cousins, relatives, friends, neighbors, teachers, schoolmates, as she goes to church, from church, everything she knows, late at night, without any explanation, thrust into a strange home, the foster parent home, with strange people, and told, here's your new house, here's your new family. So what does that girl do? I'll tell you what she does. She asks these questions. Why am I here? When do I go home? When do I see mommy next? Does mommy not love me anymore? Does daddy hate me? And then when I struggle to answer those questions, she cries herself to sleep. And the next morning she may wake up and she may not know where the kitchen is. Maybe she's not eaten in a long time because she doesn't eat. She doesn't know she can eat. She goes to school with strange students and strange teachers and given work to do, and people are laughing in school. She thinks they're laughing at her. She's given spelling words to do, math, a book to read. Someone bumps her in the hall. She just screams out, I want to go home. That's how it is for these children. It's how it is. It's a very scary time. So we need to really forget about the abuse and the anxiety these children are feeling. It's a time of anxiety for the child when they're being placed into foster care. That is a time of anxiety right there. It's a very scary time. So how we meet that time of transition into a new home is so important.
Absolutely. That's a really unique perspective that I think a lot of folks are who are thinking about becoming foster parents are really thinking, how will this affect me? How is this going to affect my home? How will my home change? And it's really unique to sort of put yourself in the shoes of the child and what their needs are. What are some of the ways that you can kind of emotionally prepare yourself for what you're about to take on as a foster parent?
Well, when that phone call comes and they ask you if you can take a child, and you need to prepare yourself, you need to ask yourself if you can, and then when you do say you can, it's a time of anxiety for the foster parents as well. It's a time of excitement. It's a time of questions. We all have questions. How old is this child? How long will they be with me for? What's the family interaction going to be like? And then it's a time of preparation, preparing yourself for the child coming yourself emotionally, as well as preparing your home. Do you have what the child needs? Do you have a crib? Do you have enough beds? Do you have a nightlight in the bedroom? Do you have towels and toiletries and school supplies if the child needs it? Do you have clothes? Because sometimes they only come with the clothes in their bag. So you need to prepare all of that as well. And then when the child comes to our home, we want to make that time of transition as warm and as inviting as we possibly can. So that is when we go out and we meet the car, we meet the child. I introduce myself as Mr. John, my wife is Miss Kelly. We allow them to call us, Mr. John, Dr. John, Papa John, Uncle John, whatever they feel comfortable with. Sometimes they might call us Daddy, whatever it may be, whatever they feel comfortable with. I'm certainly not going to insist upon anything. And then we give them the tour of the house. We show them where the bathroom is. And then when we're done with the tour, we always bring them into the kitchen. We have a plate of homemade chocolate chip cookies and a glass of cold milk, because who doesn't like chocolate chip cookies and milk, right?
Mm.
And then we allow the child to have a little bit of time by themselves, maybe play their own kids. And that's when my wife and I sit down with the caseworker and we sign all that paperwork that needs to be signed. While the child is, having that milk and cookie time or playing with the kids. It is not a time of rules. It's not a time of expectations. That comes a few days later.
Mm-hmm.
We need to allow that time for the child to grieve, because they're going to grieve. They've been separated from their family. There's separation anxiety. They're going to be scared. And I have found that it's okay for that child to go into their room sometimes and want to be alone, because again, I'm not their daddy. I can't help this child those first few nights ease their anxieties, their fears. They've got to learn to trust. They're going to have to come to the appreciation that, oh, he's not going to hurt me. I'm going to be okay. In fact, I wrote a book called A Different Home, a new foster child story. And it's from the perspective of a 7-year-old girl who goes through all that. But by the end of the story, she realizes, okay, this is a different family. It's a different home, but I'm going to be okay. It's a book that we can pull off the shelf and to read to the child, to answer their questions and ease their anxieties. Because again, this is a time of many, many questions for that child. Not the parent, we have questions ourselves as foster parents, but that child's got lots of questions as well.
I love the idea of having these traditions that are sort of your family's way of introducing a foster child into your home and welcoming the child. Are there any other traditions or anything that you've tried that was a big fail? Anything that you thought, I know what we'll do, and give it a try, and you realize, trial and error, just not the best idea, not a good fit. Anything out there that you'd want to share, maybe as kind of a lighthearted moment of failure?
Well, I think I mentioned in one of our interviews that I was not prepared. I recognized I was not prepared the first time, within the first 20 minutes. I really thought the child was going to come in happy, excited to be at my house. And then that child is having an emotional meltdown and wanting to go home and yelling about it. I thought, what's going on? I'm not ready for this. And then I had to change my attitude about my perspective. Oh my goodness, this child is scared to be in my house. Yeah. I'm a stranger to this child. And then, of course, every time a child comes, they're going to have a different reaction to it. But we try to generally keep it the same. We want to make it as warm and as inviting and as less threatening to that child as we possibly can.
That's great. And what about as far as bringing that child into your community and into their new school community? Is there anything that you do as a foster parent to prepare teachers or coaches, anything like that, any other adults that they're going to be interacting with, just to really bring in that collaborative piece?
Sure, great question. I try to meet with them, as many people as I possibly can. And as much as I'm allowed to give due to privacy rules, I try to share some of that story with the teachers, with those coaches, with those other people, because I want them to understand where this child's coming from. Why are they not doing their work in the classroom? Or why are they acting out? Why are they withdrawing? Why are they lashing out? Because when they get when that teacher, that coach, that caregiver, whatever it may be, when they get some insight into the child, and they begin to understand the child, and they have more compassion and more understanding towards that child. And I think when we understand where the child's coming from, then we're more willing to make allowances for that child. So I always ask for teachers and coaches for some flexibility when it comes to homework or tests or quizzes or whatever it may be. And I think most are willing to do so once they understand where the child's coming from in their background. It's really important. So again, I try to meet with as many people as I possibly can, and I give each of them, here's my phone number, here's my email, please contact me immediately if I need to know something. So when they do come home from school or from wrestling practice or ballet or piano, my kids have been all those things, or camp, whatever it may be, when they do come back to my home, I've got a heads up and I can meet that child's anxieties when they come here and know how to address it.
What about, you mentioned privacy, and it makes me think too, how far that extends out. So what recommendation would you give to a new foster parent about talking to neighbors, talking to folks who may not be in your immediate circle, but these are folks that are going to be, as far as safety and privacy, Is that something that you share with your neighbors? Do you recommend that? Do you recommend waiting for the neighbor to come to you? How do you sort of handle that kind of questioning?
Well, first of all, there's not a label. It's not a foster child. I just
Mm-hmm.
tell people, this is my child, or he's living with me for a while. I'm so happy that this little Sally is spending some time with us, and how excited we are about that. Or little Johnny's joining our family.
Yeah.
So I introduce that way. No, I don't seek everybody out and say, hey, I want you to know so-and-so's living with me. That's, I don't want it's intimidating enough for the child. So I don't want them to feel they are labeled, and I don't want to feel that they're under the microscope as well. If someone needs to know, I will certainly let them know. Fortunately, where I live, the community I live, we've been doing this for 16 years. People just think, okay, they've got another child. There they go again,
Yeah.
and a lot of people, I think, admire what foster parents do, and they say they're heroes and they're saints.
Yeah.
Most foster parents will tell you we're not heroes, we're not saints, but I'll tell you this, foster parents are, because it's a challenging job, and they're doing something that so many people will not do, and that's care for a child in their own home. That's not theirs.
Something that's really intimidating to a lot of prospective foster parents is the home study process. And when we talk about getting your home ready, can you talk to us? I know it's different in every state, I'm sure, but what that sort of looks and feels like, and just kind of in general, your experience with that.
It's a very important part of foster parenting is making sure the house is safe for that child. And a house inspection is essential, necessary, important, and I'm grateful for it. Because they might find something in my own home that might affect my own family. And that's why I want to know about that as well. But yeah, we need to ensure the safety of the child, and we need to ensure the safety of the family as well. It should not be a time of great concern. So I'm looking at those people who are prospective foster parents and say, don't worry about it. It's part of the process. You'll be fine. You're not being judged. We're just trying to ensure that your house is safe for this child being placed in your home. It's something that every single foster parent needs to go through it several times. We inspected it once a year where I live. And again, it may feel intimidating, but please don't worry about it. I have an online training webinar about this, about preparing your home, house safety, if you will, house safety. And it goes far beyond just foster parenting, just making sure your house is safe in general.
What are some of the other misconceptions? I know, the home inspection is one. What are some of the other big misconceptions when you're going around and training, talking to folks? What are some of the things that you hear time and time again that you would love to, any myths that you want to bust for us about foster care?
Yep. You have to be married. No, you don't. I've met some wonderful single foster parents. I am a good friend with a single foster parent, 52-year-old male. He's doing a great job. You have to have a big house. No, you do not. You have to be rich. No. In fact, people say, oh, there's a misconception. Foster parents are in it for the money. Oh my goodness, how many times have I heard that? So far from the truth. So far from the truth. We get a small per diem every day, and that covers some. Do I expect to be? Do I expect to get all the money I spend back on the child? No, I don't. I try to give the child every single opportunity, but there is a per diem every day. I tell people that I'm rich, but I'm rich in love. I'm rich in memories. I'm rich in adventure. I'm rich in joys. I'm rich in experiences. Other misconceptions are the kids are bad kids. They're not. These are children who are victims of abuse, neglect, abandonment. These are children looking for somebody to give them a chance, looking for someone to show them some love. And there's a misconception that foster parents are a bit strange. That's true. We've got to be a little bit odd to do what we do, because it is not a normal lifestyle. Not a normal lifestyle at all.
Right.
Foster parenting is a life of sacrifices. We make sacrifices of our own time, of our own memory, of our own house. You should see my house. Oh my gosh, there's not a clean wall in the house. Crayons on every single wall in the house. But those are great memories too. Oh, look at that. I remember when little Sally drew that smiley face at the time I was looking, oh my gosh, now I'm thinking, oh, I miss you. Yeah, there are a lot of misconceptions out there, and I try to shed some light on that wherever I go.
That's great. And I would love to hear too about some of the things that some of the things you've learned about yourself, I guess, and learned about either parenting or just yourself watching your foster children come through your home and some of the lessons that they've taught you?
I've learned that I can never be a perfect parent.
Mhm.
I learned that you do not have to be perfect to be a foster parent. I learned that it's okay to make mistakes. I've learned that it's okay for as a male to cry. And in fact, I kind of embrace that. I think it's important for the children in my house to see me cry because it shows that I'm human. I make mistakes. I'm not afraid to share my emotions or express myself in an emotional fashion, and that can be a strength itself. I've learned that learning is an ongoing process, and I learn something new every single day, and that can be a wonderful adventure as well. I've learned to look for the good in every situation and every person. I've learned not to be judgmental, because at first I was kind of judgmental towards the birth parents. How dare you do this to this child? And then I've realized so many of these birth parents are victims themselves of abuse, of neglect, of abandonment, who are suffering with their own pain and their own trauma.
Mm.
Oh my gosh, I've learned so many things as a foster parent, and that's one of the things I love about being a foster parent is learning something all the time.
Yeah. I think expect the unexpected.
Oh my gosh.
It's probably huge.
I've learned you have to be flexible as a foster parent. If you are a perfectionist, that goes out the door during your first placement, because there's no room for perfectionism when you got kids who are coming in your house and turning your life upside down right
Right.
away.
Right. And what's some of the takeaway, when a child comes through your home and then eventually leaves your home, which is something that feels heartbreaking and we don't talk enough about. Talk a little bit about that process and how you allow yourself the space and the time to go through that process.
Perhaps the most requested training session I give across the country is grief and loss for foster parents. It's a very, very real issue for foster parents. Grief and feelings of loss are very real, very normal, very normal. Some foster parents feel guilt when a child leaves their home, or they may feel guilt if they've had to ask a child to be removed from their home. Many foster parents may sink into a time of depression, a time of bargaining, a time of anger or resentment towards the agency, the judge, the caseworker, themselves, sink into great time of grief. And those are all normal. They're all normal emotions. But finally, that all leads to, at some point, acceptance. And so I tell foster parents, it is so essential that you recognize this is a time of grief for you. This is a time of loss, because it's like losing your own family member. And there are those moments, there are those times where we may not agree with the child being removed from our home. We may fear for the child's safety, but we have no control. As foster parents, we have no control over that. So it's important that we allow ourselves to recognize that we're not in control, that grief is normal, that we need to allow ourselves time to grieve for this child, to give ourselves some space and time to do so. And that's where that support group is essential as well, that we spoke about earlier. And that it's hard.
Yeah.
It's hard being a foster parent because our hearts break.
Yeah.
Absolutely. And I've cried buckets. Oh my gosh, I've cried buckets. But at the same time, I'm grateful that I've had the opportunity to cry for these children, because I might be the first person who ever cried for that child. So I'm giving them a gift of my heart, of all that love. Does it hurt? Yeah. But I'm glad I have that pain, because it means I've given that child the unconditional love that he just has to have.
Yeah, I think self-care is something that, we've talked a little bit about respite, we've talked about support groups, and really just in general, self-care is something that's so key in preventing burnout, preventing the compassion fatigue that we've talked about too, and just reaching out when you need help.
Right. I've got entire chapters devoted to all these issues in the book, The Foster Care Survival Guide. How do you help yourself during these times? And if you don't help yourself, then you're not going to be a good placement for the next child coming here.
What are some of the really basic, I know you said there's sort of a list of questions that you ask yourself. What are some of the really basic ones really quickly as we wrap up that you want to ask yourself before you say yes to a placement? Things that maybe somebody hasn't thought about yet.
Sure. I'm always going to ask how old the child is, how long is the child being cared for, why is the child in care, Are there any medication? Are there any issues of anger? What kind of disorders might they have? I have to determine if this child's going to be safe in my own home and if my own family will be safe, my own children will be safe. So I have to ask if there's issues of, what kind of abuse have they experienced, and will that affect my own family? How young or old is that child? How are they doing in school? How are they medical? Are there medical issues involved that I need to meet or I might not be able to meet? How often are visitations? Because can I get that child to visitation twice a week? Those are just a small list of what I have as a very long list.
Yeah, sounds great. Well, we can always point to the Foster Care Institute for more resources, lots more tips, and a sort of toolkit, if you will, for potential foster parents to guide them for some resources. I think this is all such valuable information. We're so happy and grateful to have you with us, and look forward to our next interview with you. We thank you so much for your time, and we'll speak with you soon.
Great. Thank you so much. I appreciate it. Bye-bye.
Bye.